I'm Heather So. I've been an occupational therapist for almost 20 years. I'm a bereaved mother and I've just completed my PhD looking at how to integrate spirituality into healthcare. In this video series, I'm looking at some of the key things I've learned about how to approach healthcare more holistically. In this last part, I'm talking through what our role is in approaching client spirituality. I want to say up front that many textbooks have been written on the subject of ethics, and this short video in no way replaces those or tries to sum up those. But I hope that this simple illustration will help you think about the different roles people have in helping clients be supported in their spirituality. So if this is a client or a patient and they have now raised a spiritual concern in their healthcare journey, so I have a need. We are going to represent health professionals with this little guy. So now we're going to think about these different circles as the different relationships that are represented in supporting this patient in meeting their spiritual needs on their healthcare journey. So when a client raises a spiritual issue, one possible response is that a health professional will sit outside of any particular response and ignore that spiritual request. And that means they're too distant to even sit within any particular circle or response. And this is obviously not what we want to aim for. What we want to aim for is to sit within some kind of middle ground that is appropriate for a health professional. So within a health professional domain, what is appropriate when a client raises a spiritual issue is that we need to be actively listening, observing, and screening the situation. And if it's appropriate, we also need to be integrating the client's spirituality into our intervention plan. So whether that be their medication preferences or as occupational therapists, ensuring that any occupation we're doing is meaningful, their goals are meaningful. So this is an appropriate space for health professionals because our relationship with them involves a power imbalance, and we are not explicitly trained or expected to in-depth address spiritual or religious issues. We are here to screen. So, however, if we have actively listened and find that a client needs more in-depth support around a spiritual issue, then it might be appropriate to refer to a chaplain, someone who is within the healthcare team who has specific training in how to support someone in their healthcare journey around spiritual issues related to their healthcare journey. And a chaplain can be great because often they sit outside of a person's community, so they're more of a neutral person for someone to be a sounding board for them. And they're specifically trained in how to assess for spiritual needs. Yet a patient might want to actually speak to someone who is from their cultural or religious community because they want to talk through in-depth issues, or they want to talk to someone who they've known for many years. And so you might be asked to refer to someone who is their minister or a senior member within their culture, or even a senior member within their family, so that they can talk through whatever issue is concerning them in that moment. So these are the circles of relationship which we have, and it's important to note that health professionals have their own very important role in screening, observing, and providing active listening, and then referring on as appropriate. I hope you enjoyed this series. Please like and subscribe. Again.